Before I kick it off to Catherine, I just want to say that this is one of the topics that we've heard a lot about from our community. We get a lot of questions and concerns about access to these important therapy services, and so I'm really excited that we have an opportunity to talk to you today about this important topic. Catherine Pugh, who's PAN's Government Relations Manager, has been PAN's lead on this topic the last couple of years, and she's going to walk us through the importance of maintaining access to these therapy services and some of the hurdles that are currently in front of us in the Medicare program. So I'm going to turn it over to her, and she's going to walk us through the next couple of slides.
Okay. Thanks, Jennifer. We are going to, once we get to the next slide. Okay. So as I'm sure all of you know, many people with Parkinson's use physical, occupational, and speech-language therapy to help with the symptoms of Parkinson's disease. Therapy can help improve balance, speech, and swallowing in people with Parkinson's. And with few treatments for Parkinson's and no treatments that slow or halt the progression of the disease, therapy can be essential to maintaining quality of life and independence, and that's the main reason why PAN is heavily involved on this issue. Okay, so just to give a little bit of background and basics on medically necessary therapy, Medicare covers medically necessary therapy services up to $1,900 a year with no extra review processes. Once you've reached $1,900 for physical therapy and speech therapy combined, or $1,900 for occupational therapy, you've hit what are called the therapy caps. In this presentation, we've used green, yellow, and red to represent the amount of review required to continue therapy, not when therapy coverage stops. Basically, Medicare covers all medically necessary therapy services. Go to the next slide. So for some reason, some of the colors didn't copy over very well to this graph on this computer, but when we send out the presentation, we'll make sure that that's fixed. But there are some processes that are triggered once you've hit a certain cap, and this is just a graphic representation of the processes, which we'll go through in detail right now. Okay, the first is the automatic exceptions process. And once you hit $1,900, your provider should use the automatic exceptions process if he or she deems the continuance of your therapy to be medically necessary. There is no additional review of your provider's claims by Medicare as long as your provider uses a specific code to indicate that he or she has determined the therapy to be medically necessary. The next process is called manual medical review. This year is the first time that there has been a second cap at $3,700, and it's similar to the first cap in that there are also two separate caps, one for physical therapy and speech-language therapy, and one for occupational therapy. Once you hit $3,700, your provider has to submit documentation to a Medicare contractor for approval every single time you go to the therapist. PAN has heard that there were significant problems with the implementation of manual medical review this year, and we were hearing patients were being denied medically necessary therapy. So we are working hard with our congressional champions and other provider and patient groups to ensure that this process works better in the future or is removed altogether. You're probably wondering, why all the hoops? Why are there caps? The simple answer is because of Congress. In an effort to control Medicare spending, in 1997, Congress passed legislation that created the therapy caps. However, successful advocacy kept the caps from going into effect until 2006. It became clear after Congress proposed to let the caps go into effect that the caps would not be fair to people who needed continued therapy services to maintain quality of life, like people with Parkinson's, so Congress created the exceptions process. However, the exceptions process is temporary, and Congress must vote to extend the exceptions process every year, or people will not be able to receive medically necessary therapy services over $1,900. And now we're going to go through a few commonly asked questions, and then I will pause to see if any questions have come through since we started the webinar. Our first question is, which services are subject to the cap? Outpatient therapy services furnished by rehabilitation agencies, physicians' offices, skilled nursing facilities, home health agencies, therapists in private practice, and hospital outpatient settings are all subject to the cap. And are there therapy caps in Medicare Advantage plans? Legally, Medicare Advantage plans may apply therapy caps with an exceptions process. However, many have chosen not to do so in the past, but you should definitely check with your individual Medicare Advantage plan policy if you do not know if they have therapy caps. A couple more. When does the accrued therapy services reset, or when would you start at $0 again? The answer is on the first of every year. And I'm going to pause now to see if there are any questions. Approximately how many visits are covered in the $1,900 is one question that we have gotten. Not many is the answer. I mean, it depends. Every therapist has a different amount that they charge, and so it varies by location. But if you are going to your therapist 2 to 3 times a week, like many people with Parkinson's do, you would hit the $1,900 in less than 2 months. Okay, do we have any other questions? Nope, doesn't look like it now. And if you have any other questions that are specific to your situation, you can email me at cpugh@parkinsonsaction.org. Okay, now we're going to move on to what PAN is doing. Every year, PAN works to ensure that the exceptions process is extended by Congress by the December 31st expiration date. As I said before, if Congress does not extend the exceptions process, Medicare beneficiaries won't be able to receive therapy services beyond $1,900. And moving on to our other work, PAN believes that the best solution is to provide certainty to both patients and providers. And along those lines, we support a long-term solution to the Medicare therapy caps. And we've supported a bill called the Medicare Access to Rehabilitation Act of 2013, which would remove the therapy caps altogether. However, this bill would cost a lot of money, and it is likely that it won't pass on its own. So PAN has pursued other opportunities in the meantime. One of those opportunities, more recent opportunities, is what is called the Medicare Sustainable Growth Rate. Every year, Congress also has to pass a fix to the Medicare Sustainable Growth Rate, which is a formula that is used to determine how much Medicare doctors are paid. And they have to fix it, or doctors would see about a 27% cut, which would mean some doctors may stop seeing Medicare patients altogether, or some may stop accepting new Medicare patients. So Congress really prioritizes a fix every year. But this year, there's been significant movement in both the House and Senate to permanently fix the sustainable growth rate formula, and legislative proposals to do just that have been released. Since Congress usually considers the sustainable growth rate and the exceptions process together, and they were actually created in the same legislation in 1997, PAN is advocating that Congress include a permanent fix of the therapy caps in their legislation to permanently fix the sustainable growth rate. We likely won't know more until after Thanksgiving, unfortunately. Actually, the latest breaking news is that the Senate is going to take up their permanent sustainable growth rate bill on December 12th. But we are hopeful that we can come to an agreement on a permanent fix for the therapy caps this year, and we'll be working hard over the next couple of weeks to educate members about the burden of the therapy caps and the importance of a permanent fix. And then moving on to the next slide. Sorry. There we go. The Therapy Cap Coalition, as many of you know, many voices are better than one. So PAN is a member of a coalition called the Therapy Cap Coalition that includes many provider and other patient groups who work to find a permanent fix to the therapy caps. And I listed just a few of the members on the slide. For example, we have some provider groups, including the Physical Therapy Association and the American Occupational Therapy Association, the Speech Language Hearing Association, and also very prominent patient advocacy groups, the National Multiple Sclerosis Society, Brain Injury Association, and the American Heart Association, American Stroke Association. And then, in addition to PAN's work, what can you do? Because we definitely need your help to get this done. The most important thing you can do to help end Medicare therapy caps is contacting your members of Congress and asking your friends and family to as well. You might have already seen our action alert on this issue come through your inbox a few weeks ago, but if you didn't, I will be sending the information in an email after the webinar. I'm going to pause again to see if there are any questions that have been come in, and I think that there is. I was told that MS patients are exempt from therapy caps. Is this true? No, that's not true. All Medicare beneficiaries are subject to the therapy caps. However, medically necessary therapy can go over the $1,900. So no, there is no disease-specific exemptions. It is an automatic exemption for all Medicare beneficiaries. Another question?
It's more of a comment, and the comment is, I work in an outpatient physical therapy clinic, and we have determined the rough estimate of 60-minute visits to be 14 or 15 visits to meet the $1,900 cap. So for the previous question about how many visits for the $1,900, so about 14 or 15, so that's, a couple each week. That's about 2.5 months, give or take.
Okay, great. Yeah, thanks for that comment. Okay, I'm going to turn it over to Jennifer to talk about the improvement standard, which I know is a pretty hot topic this past year.
So for those of you who are not familiar with this, just give a little bit of background. We've heard from many advocates that Medicare had denied them their therapy services because their condition had not improved. And so this is called the improvement standard. Because of hearing from many people with Parkinson's disease, PAN actually joined a class action lawsuit joined with the Center for Medicare Advocacy. And the lawsuit was against the U.S. Department of Health and Human Services, which oversees the Medicare program. And the class action lawsuit was aimed at removing Medicare's improvement standard measure for Parkinson's and other degenerative diseases. We did not feel that the improvement standard was an appropriate standard for Parkinson's disease because Parkinson's is not necessarily rehab-focused like other diseases or conditions covered by Medicare. As you guys know, rehab and therapy services are important to improving quality of life, and often symptoms benefit from rehab at the same time. But Parkinson's is a degenerative disease, so it's difficult to measure improvement, and where successful therapy might mean slower degeneration. This is why we felt that joining the lawsuit and removing the improvement standard was critical to Parkinson's patients so that they continue receiving therapy services that are integral to their day-to-day lives. Luckily, we're very excited that the lawsuit actually reached a favorable settlement in January of 2014, and this requires the Centers for Medicare and Medicaid Services to actually go through and revise its Medicare benefit policy, guidelines, and instructions to ensure that Medicare coverage is available for skilled maintenance services in home health care, home health, nursing home, and outpatient settings. They are required to develop and implement a nationwide education campaign for all who make Medicare determinations to ensure that beneficiaries with chronic conditions are not denied these critical services just because they will not improve. And so actually currently Medicare is in the process of updating those policy manuals and creating those educational tools, and they have 1 year to do so. So as of January 2015, we do hopefully expect that those are updated and available. Just because the policies aren't currently updated doesn't mean that you can be denied now, and so there are, if you feel like you have been denied your coverage, there are tools, self-help materials that are available on the Center for Medicare Advocacy website, which is medicareadvocacy.org. They do have some very good guidance and tools that are available should you need them. I think we have gotten a lot of questions about the improvement standard versus the therapy cap, and they are two completely separate issues. While they do both talk about therapy, the bottom line is that people with Parkinson's can continue their medically necessary therapy services above the $1,900 cap without having to show improvement. But if your therapy services are not deemed medically necessary, then the provider can stop those services. So I think that's just an important distinction. But we are looking forward to having this improvement standard removed, and hopefully providers and as well as the Medicare reviewers that have to look through the claims will be able to make sure that this isn't discriminating against people with Parkinson's and other neurodegenerative diseases.
Okay, thanks for that. We have listed a few resources here that are available for people that have additional questions. Unfortunately, you can't click the link through our webinar software, I believe, but I will be including this in my email this afternoon. On our website, we have a downloadable fact sheet to share with your providers about therapy caps, and we have some additional outpatient therapy claims, frequently asked questions. And if you have, as I said before, if you have specific questions, you can email me. My email address is right here on the slide, or you can call me. My phone number is also right there on the slide. Okay, so stay active on this issue. How can you stay active? Your voice is important. When we're on the Hill, when Jen and I are on the Hill meeting with members of Congress and their staff, we're constantly asked, how do people with Parkinson's feel about this? But it is essential that you make your voices heard with your members of Congress. PAN will send updates when it is the right time to contact your members of Congress about Medicare therapy caps. And we always have pre-written messages that we encourage you to personalize, and then all you have to do is enter your contact information and hit send. And if you're not already signed up for our action alerts, please visit our website, www.parkinsonsaction.org, to sign up for PAN action alerts. And now I think we're just about wrapping up. I will pause to see if there's any other questions. No? No other questions? Okay, great. Thank you, everyone, so much for joining. You can follow PAN on social media. We're on Facebook at www.facebook.com/Parkinson'sAction. Or you can also follow us on Twitter. Our Twitter handle is @PanTweets. And we also encourage you to take our very short webinar survey, which will be emailed out this afternoon, but you can also find it on this link. And you can email me, and my email address is right there on the slide, cpugh@parkinsonsaction.org. And I see someone, Phyllis Ehrman, one of our grassroots advocates, leaders, mentioned that it's important to remember that Parkinson's patients may also have other conditions requiring therapy. Very true, which is why it's all the more important that we work to remove the therapy caps, because if people with Parkinson's are using therapy for other conditions, they'll hit the cap even faster, and especially physical and speech therapy are combined under one cap, and those are the therapies that people with Parkinson's use the most. They hit the cap fairly early, and we're working to make sure that's fixed.
We also got a question about obtaining access to physical therapy and whether or not it's hard to get access to those services. And I think it's important to remember that it's always a discussion between you and your doctor about whether or not you are right for these services. And so I would encourage, if you aren't having physical therapy or occupational or speech language therapy, if that's of interest and you think it would be beneficial, that's a discussion that you should have with your doctor, your movement disorder specialist, or your neurologist. And so next time you go in for your visit, feel free to talk about it with them if you feel it will be beneficial. Are there any other questions? Feel free to put them in the chat bar if you have a chance.
It looks like anybody else is typing, so I guess we will sign off. And thanks everyone so much for joining again. And please feel free to reach out to me or Jennifer with any questions that you might have. And you'll be hearing a lot from us after Thanksgiving once everything on Capitol Hill really starts rolling, and we can hopefully get a permanent fix for these hurdles. Thanks so much, everyone.